Welcome. We're back for another Iceberg in today's video, and since I heavily value the time of both you and I want to make this intro quick. We'll be covering the disease iceberg today. There are tons of diseases that even I had no clue about before doing research on this list, so I think it's a pretty good one. With that said, I'm not going to separate these by tiers since there are 14 tiers, and each tier has 5 to 6 entries. It'll break up the pace too much, and I know it's going to annoy you guys. So I'll go from top to bottom, with each entry being more obscure and disturbing than the last. With that said, I want to try and hit 20,000 subs by the end of the year, so please leave a like and subscribe if you enjoy content such as this. It's free and we both win, right? Anyway, let's get into the video. Starting off with the common cold. We start off the list with the most common disease, and I'm sure most of you guys know what a cold is, so I'll make it quick. This is an infection that affects your nose and throat that's usually caused by a virus. Common symptoms include everything you see in a TV show when someone's sick: sore throat, coughing, sneezing, sometimes even a fever, that sort of stuff. Most people recover in a week, and you can't cure it, so you just gotta wait it out and deal with the symptoms. Influenza, or the flu for short. This is another disease that can be easily spread through coughing, talking with people, sneezing. Similar to the cold when it comes to symptoms, but it can go a step higher, including vomiting, diarrhea, body aches, chills, things like that too. It can knock you out for a week if it gets bad enough and can lead to pneumonia. The best way to not get hit by the flu is to take the flu shot, but you can do just as good of a job if you take care of yourself by washing your hands consistently, avoiding contact with those who are sick, etc. Like the cold, you can stay hydrated and take medicine to reduce symptoms, but you're gonna have to wait it out. Chickenpox. Chickenpox is another classic on the list, but something you don't really hear about once you're an adult since it usually affects kids. Primary symptoms of this illness is usually like an itchy rash that can turn into blisters filled with fluid and scabs all over your body. It'll also come with fevers, exhaustion, headaches. It spreads through respiratory functions like sneezing and coughing, but it can also spread through direct contact with the rash if someone were to touch it, then like scratch themselves or eat some food or whatever. There is a highly effective vaccine for this illness, and most people usually recover from it without serious problems, but there is a chance that it can lead to your brain swelling or pneumonia. If you do get the chickenpox, the best way to deal with it is to just sleep it off and to not scratch the rash whatsoever. Diabetes. Diabetes is a chronic condition where the body either doesn't produce enough insulin or cannot properly use the insulin that it creates. For those who are unaware, insulin is a hormone that helps your body turn sugar from food into energy. And there are two main types of diabetes. Type 1, this is where the body's immune system attacks insulin producing cells. And type 2, where the body becomes resistant to insulin or cannot produce enough of it. Common symptoms include excessive thirst, frequent urination, fatigue, blurred vision, and slow healing of wounds. If left untreated, diabetes can lead to even worse problems like heart disease, nerve damage, kidney failures, just everything you don't want to deal with. Preventing type 1 is not possible right now, but you can prevent type 2 by just having a healthy lifestyle, maintaining a balanced diet, exercising, the normal stuff that you should already be doing. COVID-19. So C-19 is a respiratory illness that was caused by the SARS-CoV-2 virus. It spreads the same way every other virus spreads: talking, sneezing, touching things in your face, the usual. Symptoms range from mild to severe. It can go from fevers and just coughing to losing your life through pneumonia, respiratory failure. It actually ranges quite wide for this virus specifically, and you can prevent it by getting vaccinated, wearing masks. The same way you prevent every other virus, you can prevent C-19. If you do get it, you just gotta sleep it off, drink a lot of water, get medicine, and when things get really bad, you're gonna have to go through oxygen therapy, antiviral drugs, that expensive stuff. But nowadays, we're way more aware of C-19. We wear masks a lot more. We take care of our hands and ourselves, so you don't really have much to worry about. Pneumonia. So pneumonia is an infection that inflames the air sacs in one or both lungs, which can be filled with fluid or pus. It can be caused by viruses, like I previously mentioned in some entries before this one. Bacteria or fungi is like with the common cold and the flu. A lot of these earlier entries are going to have similar causes because, we're at the top of the list basically. And symptoms include fevers, chills, difficulty breathing, which is usually like the prominent symptom, but also chest pain, fatigue, and confusion. And the severity of this disease can range from mild to life-threatening. Mild would be like coughing and a cold, fever type of thing. Life-threatening is where you start having the chest pains, having a very hard time breathing, and bad enough to a point where you have to visit a hospital. Prevention does include a couple of steps. You can get vaccinated against the flu and pneumonia. You're also going to have to maintain good hygiene, like washing your hands all the time, the same way you avoid every other virus. And if you have it but you need to treat it, the bacterial pneumonia, which is just the more severe version of pneumonia, you're going to have to treat that with antibiotics. Whereas viral pneumonia, which is the light version of it, you're going to have to handle that with rest, fluid, and regular medication that you can pick up. You're usually able to figure out what you got to do by consulting a medical professional who will point you in whatever direction you need to go in. It's usually recommended to go get a checkup if you think you have pneumonia. Cancer. Cancer is a group of diseases that are characterized by the uncontrolled growth and spread of abnormal cells in the body. And these cells can eventually create tumors or spread through the blood and lymphatic system, as in leukemia. There are tons of different types of cancer, such as lungs, colon, prostate, breast, each affecting the different parts of the body that I mentioned earlier. Symptoms can vary depending on the type, such as unexplained weight loss, fatigue, pain, abnormal bleeding. Really, anything can happen to a victim of cancer, which is one of the many reasons that I fear it so much personally. Preventing cancer involves reducing risk factors. Yes, you can't even prevent it 100%, but to get back on the track, you should avoid smoking, limiting your alcohol consumption, maintaining a healthy diet, exercise regularly, and protect yourself from excessive sun exposure. You can also do mammograms in order to detect cancer early when they're easier to treat. Treatment options do depend on the type and stage of cancer that one may be dealing with, but there's surgery, chemotherapy, radiation therapy, immunotherapy, the list goes on. The most important of all is early detection and treating it as soon as it's detected. Salmonella. Salmonella is a type of bacterial infection that affects the digestive system, like the stomach and intestines. This is commonly contracted by eating contaminated food or water, usually undercooked meat like chicken, eggs, unwashed fruit, vegetables, and symptoms will pop up within 6 hours to 6 days. And these include diarrhea, stomach cramps, fever, nausea, vomiting, the typical symptoms you'd get with anything that involves the digestive system. Most people usually recover without treatment. It can be serious in young children or older adults, people with weakened immune systems overall. Of course, preventing this from happening just involves proper food safety. Don't eat any raw food. Wash your hands after handling raw food, using the bathroom, or touching animals. Basic hygiene. Stroke. A stroke occurs when there is a sudden problem with the blood supply to the brain, which leads to brain cell damage. This can happen due to a blockage or a burst blood vessel, and these two causes are categorized into two different types of strokes. When a blockage happens, this is usually from a blood clot that obstructs an artery, whereas the burst blood vessel usually comes from bleeding in or around the brain. Symptoms of a stroke can include numbness, weakness in the face, arm, leg, pretty much any part of the body, confusion, having trouble speaking, understanding speech, having some trouble seeing, dizziness, or loss of balance. And you can prevent strokes by managing risk factors, these factors being high blood pressure, diabetes, high cholesterol, and smoking. Usually maintaining a healthy lifestyle is going to be a way you can deter strokes like cancer. And there are rare cases where people have conditions or certain disabilities which can result in them having a stroke, and surgical procedures are available for people that fall into that category specifically. HIV. This is short for human immunodeficiency virus, and this is a virus that attacks the body's immune system, specifically CD4 cells. These are crucial for fighting off infections, and if untreated, it can lead to AIDS, which is acquired immunodeficiency syndrome. This is a stage where the immune system is actually damaged, and it's going to make it very difficult for your body to fight off diseases and infections. HIV is spread through contact with certain body fluids, including blood, all sorts of stuff through unprotected intercourse, sharing needles, or from mother to child during birth or breastfeeding. Preventing HIV will involve just having safe intercourse, getting regularly tested if you're at risk, not sharing needles, and there are also preventive medications such as PrEP. And what PrEP does is prevent you from getting any STDs. Well, not completely prevent, but significantly reduces the risk of it. E. coli. This is a type of bacteria that's found in the intestines of humans and animals. While most strains are harmless and can help with digestion, some can cause serious foodborne illness. These infections are often linked to consuming contaminated food or water, such as undercooked ground beef, raw vegetables, certain dairy products, things of that nature. And symptoms of an E. coli infection are the same as every other digestive system infection: nausea, diarrhea, stomach cramps, vomiting, things like that. And sometimes, if it gets really bad, it can lead to kidney failure. Preventing E. coli is actually pretty easy. I'm sure you guys already do it every day. Just practice good food hygiene, wash your hands, things of that nature, and you should be fine. Dengue fever. Dengue fever is a viral infection that's transmitted through the bite of an infected Aedes mosquito. These are usually found in tropical and subtropical regions, and the virus causes a high fever, severe headaches, pain behind the eyes, joint muscle pain, skin rashes, tons of stuff. I mean, the list goes on. In severe cases, dengue can develop into a hemorrhagic fever or dengue shock syndrome, both of which can be life-threatening and will require immediate medical attention. Preventing dengue fever just involves reducing mosquito exposure. This can be done by wearing long sleeves and pants, mosquito nets, insect repellent. The same way you do it at home, just do it in subtropical regions as well. But if you do get this illness, there's no specific treatment for it. You're just gonna have to sleep, stay hydrated, and take pain relievers like acetaminophen. If things get really bad, you're gonna have to go to a hospital. I don't think there's really much you can do but just sit and pray it doesn't get worse if you do get the dengue fever. Meningitis. This is an inflammation of the protective membrane surrounding the brain and spinal cord. It can be caused by bacteria, viruses, fungi, or parasites, with bacterial meningitis becoming the most serious and life-threatening form that this illness can take. Symptoms usually include a high fever, headache, stiff neck, sensitivity to light, confusion, nausea, vomiting. This is another one where the symptoms are just endless. It can get as bad as death. You can get vaccinated against meningitis, but just also practice normal hygiene, washing hands, covering your mouth, things of that nature. Meningitis is also one of those diseases where if you have it or you think you have it, just go to the hospital immediately. SARS. SARS is another respiratory illness that's caused by the SARS coronavirus, and this emerged in 2002. Yes, coronavirus was a thing before 2020, and SARS primarily spreads through respiratory droplets, same way that every other cold and virus spreads, coughing, sneezing, etc. Symptoms for SARS includes high fever, chills, muscle aches, cough, difficulty breathing, and if it gets really bad, it can progress to pneumonia. Yellow fever. Yellow fever is a viral disease that's transmitted through the bite of infected mosquitoes that are usually in the tropical or subtropical regions of Africa and South America. This virus hits the liver and other organs, which can lead to symptoms such as fever, chills, headaches, nausea, vomiting. The list goes on. It can even go to a point where it causes jaundice, and this is yellowing of the skin and eyes. This is actually where yellow fever gets its name. You can prevent yellow fever through vaccination, and the vaccination is required for you to enter those countries, so you don't really have a choice. You can also prevent it through insect repellent, the same way you prevent mosquitoes from getting to you every day. But there's no treatment for yellow fever, so when you get it, the best thing you can do is try and reduce the symptoms. But if things get severe, like in all other cases in life, seek hospitalization. Epilepsy. This is a neurological disorder that causes unprovoked seizures within someone's brain. Seizures can vary widely in type and severity, ranging from brief periods to staring or confusion to full body convulsions and loss of consciousness. Epilepsy can develop at really any age, and it can result from brain injury, infection, genetic conditions, unknown causes. It can really come out of nowhere. And managing epilepsy often involves certain medication to control seizures, surgeries, dietary changes, therapies, and to prevent seizures from coming out of nowhere due to your epilepsy, you're gonna have to get a lot of sleep, prevent yourself from stressing out, and try to not look at flashing lights. People with epilepsy can often lead a normal life, but they do have to just stick to their medication and avoid certain triggers. Leukemia. Leukemia is a type of cancer that affects the blood and bone marrow. This is where blood cells are produced. Leukemia occurs when the bone marrow produces an excessive amount of abnormal white blood cells. This interferes with the body's ability to fight infections, produce healthy blood cells, and carry oxygen. When you have leukemia, you'll be dealing with frequent infections, just a lot of weight loss, you'll bruise easily, bone pain. It's just not a fun experience, and preventing leukemia is not always possible because nobody really knows the exact causes, but you can always reduce your exposure to it the same way you normally reduce exposure to cancer. Just exercise, don't smoke, live a healthy lifestyle, things of that nature. And to treat it, that involves chemotherapy, radiation therapy, things of that nature, just like these really obscure and deep medical therapies. Parkinson's disease. Parkinson's is a progressive neurological disorder that affects your movement, and this occurs when nerve cells in your brain that produce dopamine, a chemical responsible for coordinating movement, begin to die. And once they begin to die, you'll start experiencing things such as tremors, muscle stiffness, you'll move slower and have a messed up balance and coordination throughout your body. Over time, these symptoms will only get worse, and it's gonna get to a point where you have difficulty writing, you'll have cognitive decline. It's a sad and slow deterioration of your brain. There's no cure for it, but there are treatments that can help you manage the symptoms, such as medicine, surgeries. There's also physical therapy, exercises you can do, and just maintaining a healthy diet. It's very difficult to deal with, but if you start early treatment and start planning out how you're going to deal with Parkinson's, you can actually handle it well. Hepatitis. Hepatitis is when your liver gets inflamed, often because of a virus, but it can also happen due to alcohol, toxins, and certain diseases. I'm gonna make this breakdown quick because it can become a rabbit hole, but there are 3 different types of hepatitis: A, B, and C. A usually spreads through contaminated food or water, while B and C will spread through contact of blood or other bodily fluids. Common symptoms will usually include feeling tired, yellowing of skin and eyes, nausea and belly pain, and if you leave it untreated, it can even go all the way up to cancer. To prevent hepatitis, you can get vaccines for A and B, and for avoiding C, you're gonna have to avoid contact with infected blood, practice safe intercourse, and not share needles like the previous STDs. You can get away with hepatitis A, like just sleeping it off and chilling out, but B and C, you're gonna need medication, and you should get that checked out ASAP. Typhus. Typhus is a bacterial infection, and this usually comes from lice, fleas, or mites that have bitten other infected people, and then they jump on you and bite you. That's how you can get typhus. And there are different types of it: epidemic, endemic, and scrub, each associated with different vectors. Common symptoms of all the typhuses are the same with every other illness at the beginning, but at the worst, it can lead to liver failure or the swelling of the brain. Preventing typhus is going to involve just avoiding contact with those sorts of insects by maintaining good hygiene and insect repellent. You just got to make sure you don't get hit by it. But if you're unlucky enough to get hit by it, then there are antibiotics available at your closest urgent care or hospital. Gonorrhea. Gonorrhea is an STI, which is an STD but replaced disease with infection, and it affects both men and women, primarily infecting the urethra, rectum, throat, or in women, the cervix. For us dudes, we're usually gonna have to deal with a burning sensation while using the bathroom, or painful and swollen testicles. In women, you're gonna have to deal with painful urination or pelvic pain. But there are cases where people have no symptoms whatsoever, and this results in gonorrhea spreading even more. Preventing gonorrhea just involves practicing safe intercourse, and if diagnosed, it can be treated with antibiotics, although as of recent, some strains are becoming resistant to certain medications, so you need to complete treatment as prescribed. And if it's untreated, it can lead to people just being infertile. So yeah, if you want to have kids, you should probably get that treated. H1N1, this is just another name for swine flu. I don't know why they went with like the official name instead of a name that everybody knows, but the swine flu is another type of influenza virus, but this one caused a global pandemic in 2009. It spread similarly to like the seasonal flu, you know, breathing, coughing, sneezing, things of that nature, and the symptoms are the same as the regular flu as well. This is a good time to remind you guys that I'm not a medical professional, but I think this is just a different strain of the virus. It's not really different. Chlamydia. Chlamydia is another common STI which is caused by bacteria spreading around, and this one often affects young people and will affect the same areas such as genitals, rectum, and throat as gonorrhea did. Many people with chlamydia don't experience any symptoms. This is why it's referred to as a silent infection. But when symptoms do appear, they're like the same as gonorrhea, you know, burning pains while using the bathroom or eventual infertility. The way you prevent this from hitting you is the same way you prevent anything with ST in it. Just practice safe intercourse and make sure you get tested. H5N1 is the bird flu, another strangely named entry on this list. It's a type of flu virus that affects birds, but it can sometimes hit us as well. Bird flu spreads through contact with infected birds, their droppings, or contaminated environments. Human cases of the bird flu are rare, but when it happens, it's severe. You're going to be dealing with a high fever, sore throat, muscle aches, difficulty breathing, and it can lead up to very dangerous levels of pneumonia. It's to a point where most people who are infected will die. However, it's not easily spread. It does take a bit of effort, so you probably don't have to worry about it if you practice basic hygiene or if you avoid areas where an outbreak of the bird flu is currently going on. Syphilis. Syphilis is another STI, but this one develops in stages, each with different symptoms. In the primary stage, you'll start with a painless sore that will appear at the site of infection, usually the mouth or genitals, and the sore heals on its own, but if you don't treat it, it can progress to the secondary stage, causing symptoms such as skin rashes and sore throats. And if you don't treat it at this stage, it's going to enter the latent stage, where there are no visible symptoms, but the bacteria will be in the body. At the latent to final stage, you're going to have the infection cause serious damage to the heart, brain, and other organs. This leads to long-term health problems relating to whatever's being hit by it. Alzheimer's. Alzheimer's is another neurological disorder. This one affects memory, thinking, and behavior. Alzheimer's is the most common cause of dementia, which is a group of brain disorders that result in the decline of cognitive function. In Alzheimer's, brain cells are damaged and die, and this leads to memory loss, confusion, difficulty in life and completing normal tasks, changes in mood, personality. Pretty sure most of us are familiar with Alzheimer's, so I'm unsure as to why it wasn't at the top of the list. But yeah, there's no cure for it. And pretty much everybody's at risk of it as we get older. It's just one of those things that happen as our body begins to decay and cells stop forming and all the above. Tapeworm infections. A tapeworm infection happens when a person ingests a larvae or eggs of tapeworms, usually from undercooked or contaminated food, especially pork or beef. Tapeworms are flat, segmented worms that live in the intestines. Once inside the body, the larvae can grow into long adult worms that attach to the walls of the intestines and absorb nutrients from the host. Symptoms of a tapeworm infection can include stomach pain, nausea, weakness, diarrhea, and weight loss, though some people may not show symptoms at all. To prevent tapeworm infections, it's important to cook meat thoroughly and wash hands regularly, especially after handling raw meat or using the bathroom. If someone gets infected, they can be treated with medication that kills the worms, allowing the body to expel them naturally. Regular hygiene and proper food preparation are key to avoiding this parasitic infection. Black Death. The Black Death was a terrible disease that spread across Europe, Asia, and Africa in the 1300s, killing millions of people. It was caused by bacteria that were spread by fleas that lived on rats. People who got sick with the Black Death had high fevers, chills, and painful lumps on their bodies. These lumps were filled with pus, and their skin often turned black as their tissue died. The disease spread very quickly because people didn't know how to stop it, and living conditions were poor. Today, we have medicine and better hygiene, so the Black Death no longer affects people in the same way. Antibiotics can help treat it if caught early, but it's still rare in some parts of the world. Cholera. Cholera is a dangerous disease that can make people very sick, mostly through dirty water or food. It affects the stomach and intestines, causing severe diarrhea and vomiting. If someone doesn't get help, they can lose a lot of water from their body very quickly, which can be deadly. The best way to prevent cholera is by drinking clean water, washing hands, and eating safe food. In areas where cholera is common, people sometimes take vaccines to help protect them. If someone does get cholera, doctors can treat it with fluids and special salts to replace what the body loses. Smallpox. Smallpox was a serious disease that caused a high fever and a skin rash with painful blisters all over the body. It spread very easily from one person to another, often through coughing or sneezing. Once someone got smallpox, the chances of survival were low, and even if they survived, they often had scars for life. Thanks to vaccines, smallpox was completely wiped out in 1980, meaning no one in the world gets it anymore. It was one of the biggest successes in fighting diseases, and now other diseases are being targeted in the same way. Ebola. Ebola is a deadly disease that spreads through contact with the bodily fluids of an infected person or animal. It causes fever, weakness, stomach pain, and in many cases bleeding inside and outside the body. Ebola spreads very fast and can kill many people if not controlled quickly. There is no cure for Ebola, but doctors can help people survive by giving them fluids and treating symptoms. Scientists are also working on vaccines to help stop outbreaks before they get worse. The best way to avoid Ebola is to avoid areas where the disease is spreading and to avoid contact with any animals that may have it. Lassa fever. Lassa fever is a disease spread by rats, especially in certain parts of Africa. People usually get it when they come into contact with food or surfaces contaminated with rat droppings or urine. Lassa fever causes fever, headaches, vomiting, and in some cases can lead to bleeding and death. Preventing Lassa fever involves keeping homes and food storage areas clean and free of rats. Infected people can be treated with special medications that help reduce the severity of the illness, but it's important to catch it early. COPD, chronic obstructive pulmonary disease. COPD is a long-term lung disease that makes it hard to breathe. The main cause is smoking, but it can also happen because of long-term exposure to air pollution or harmful chemicals. People with COPD often have a cough, feel short of breath, and get tired easily because their lungs don't work as well as they should. There's no cure for COPD, but quitting smoking and using inhalers can help people manage the disease. Doctors also recommend regular exercise to keep the lungs strong. In some cases, oxygen therapy is needed to help with breathing. Rabies. Rabies is a deadly disease that spreads through the bite of an infected animal, like a dog or bat. It affects the brain and can cause fever, headache, confusion, and eventually death if not treated quickly. Once symptoms appear, rabies is almost always fatal, which is why it's so important to get treated immediately after being bitten by a possibly rabid animal. The best way to prevent rabies is by getting animals vaccinated and staying away from wild or stray animals. If bitten, people should get a special series of shots right away to stop the virus from spreading. Measles. Measles is a very contagious disease that causes a high fever, cough, runny nose, and a red rash all over the body. It spreads through the air when someone with measles coughs or sneezes. Measles can be serious, especially for young children, and can sometimes lead to pneumonia or brain swelling. The good news is that measles can be prevented with a vaccine, which is usually given to children when they are very young. Getting vaccinated is the best way to protect yourself and others from this disease. Emphysema. Emphysema is a lung disease that makes it hard to breathe. It usually happens to people who smoke for a long time. In emphysema, the tiny air sacs in the lungs become damaged, so it's difficult for the lungs to take in oxygen. People with emphysema often feel short of breath and get tired easily. There's no cure for emphysema, but people can slow it down by quitting smoking and using inhalers or other medications that help open up the airways. In severe cases, oxygen therapy might be needed to help people breathe better. Polio. Polio is a virus that can cause paralysis, meaning it can make a person's muscles stop working. It spreads through contact with food or water that has been contaminated with the virus. While some people get mild symptoms like fever and sore throat, others can end up with permanent disabilities. Polio was once a common disease, but vaccines have nearly wiped it out worldwide. The The polio vaccine protects against the virus, and thanks to this, there are very few cases of polio today. However, in some parts of the world, it's still important to get vaccinated to keep the disease from coming back. Chikungunya. Chikungunya is a virus spread by mosquitoes. It causes fever, severe joint pain, headaches, and rashes. The joint pain can last for months, and while it's rarely deadly, it can be very uncomfortable. There's no specific treatment for chikungunya, but resting, drinking plenty of fluids, and taking pain relievers can help. The best way to prevent chikungunya is to avoid mosquito bites by using insect repellent, wearing long sleeves, and sleeping under mosquito nets in areas where the virus is common. Lupus. Lupus is an autoimmune disease, meaning the body's immune system mistakenly attacks its own tissues. This can cause joint pain, fatigue, rashes, and sometimes damage to organs like the kidneys or heart. Lupus can be hard to diagnose because it affects everyone differently, and symptoms can come and go. There's no cure for lupus, but with the right medications and lifestyle changes, many people are able to manage their symptoms and lead normal lives. Doctors usually prescribe anti-inflammatory drugs and medications that calm the immune system to help control the disease. Legionnaire's disease. Legionnaire's disease is a type of pneumonia that's caused by bacteria that grow in water systems such as air conditioners, showers, and fountains. People get sick when they breathe in tiny droplets of water that contain the bacteria. Symptoms include coughing, fever, shortness of breath, muscle aches, and more things like that. This disease, though, can be treated with antibiotics, but it can get serious, especially for older adults or people with weakened immune systems. Best way to handle this is just keeping your water systems clean and properly maintained. Tuberculosis, or TB, is a serious disease that usually affects the lungs but can spread to other parts of the body. It is caused by bacteria that spread through the air when someone with TB coughs or sneezes. Symptoms include a persistent cough, weight loss, fever, and night sweats. TB can be treated with antibiotics, but it takes a long time, often several months of medication. To prevent TB, it's important to get tested and treated early, especially in areas where the disease is common. River blindness is a disease caused by a parasitic worm that spreads through the bites of infected black flies. The disease is most common in parts of Africa. It can cause itching, skin rashes, and in severe cases, blindness. Preventing river blindness involves taking medication that kills the parasites and reducing black fly populations near rivers. Mass treatment programs have been successful in many countries, greatly reducing the number of people affected by the disease. Marburg virus. The Marburg virus is a deadly disease similar to Ebola, causing high fever, severe bleeding, and organ failure. The virus spreads through contact with the bodily fluids of infected animals or people. Outbreaks have been rare, but when they occur, they spread quickly and can be devastating. There is no cure for Marburg, but treatment focuses on managing symptoms and providing supportive care. Preventing the disease involves avoiding contact with animals that may carry the virus and using protective equipment during outbreaks. DIPG. DIPG is a rare and aggressive brain tumor that mostly affects children. It grows in a part of the brain called the pons, which controls many vital functions like breathing and movement. Because of its location, surgery is usually not possible, and the tumor is difficult to treat. Symptoms include difficulty with balance, vision problems, and trouble swallowing. As the tumor grows, it can lead to more severe neurological issues. There is no cure for DIPG, and current treatments like radiation therapy only slow the disease down temporarily. Research is ongoing to find better ways to treat this devastating condition, but it remains one of the most challenging childhood cancers to manage. Brucellosis. Brucellosis is an infectious disease caused by bacteria that spreads from animals to humans, usually through unpasteurized dairy products or contact with infected animals. People with brucellosis may experience fever, joint pain, fatigue, and weight loss. The symptoms can come and go, sometimes lasting for a long time. Preventing brucellosis involves avoiding raw dairy products and taking precautions when handling animals, especially in areas where the disease is common. Brucellosis can be treated with antibiotics, but it requires a long course of medication to fully get rid of the infection. Anthrax. Anthrax is a serious disease caused by bacteria that can infect humans through contact with infected animals or contaminated animal products. There are three main types of anthrax: skin, lung, and digestive. The symptoms depend on the type, but lung anthrax is the most dangerous, causing severe breathing problems and often leading to death if not treated quickly. Anthrax can be prevented by avoiding contact with infected animals and by getting vaccinated if you're at risk. If someone is exposed to anthrax, early treatment with antibiotics can prevent the disease from becoming fatal. Neuroblastoma. Neuroblastoma is a type of cancer that mostly affects young children. It starts in immature nerve cells, usually in the adrenal glands near the kidneys, but it can spread to other parts of the body. Symptoms vary depending on where the cancer is, but they often include a lump in the abdomen, bone pain, and fatigue. Neuroblastoma can be treated with surgery, chemotherapy, radiation, or stem cell transplants, but the treatment plan does depend on how advanced the cancer is and how aggressive it appears to be at the time. And there is research ongoing to find better treatments and to improve survival rates for all who get hit by it. Lou Gehrig's disease. Lou Gehrig's disease is a condition that affects nerve cells in the brain and spinal cord. This leads to muscle weakness and loss of movement, and over time, people with this disease lose the ability to walk, speak, and eventually breathe on their own. And there is no cure for this disease. It progresses over time and it will lead to death. Treatment does focus on just managing the symptoms and maintaining quality of life. Physical therapy, breathing support, and medications can help slow the progression of the disease, but once you're hit by it, it doesn't seem good. Hydrocephalus. Hydrocephalus is a condition where there is an abnormal buildup of fluid in the brain. This extra fluid puts pressure on the brain, which can cause headaches, difficulty walking, and, in severe cases, brain damage. Hydrocephalus can occur at any age, but is most common in babies and older adults. Treatment usually involves surgery to insert a shunt, a small tube that drains the excess fluid from the brain into another part of the body. With proper treatment, many people with hydrocephalus can lead normal lives, though regular monitoring is often necessary. SIDS, Sudden Infant Death Syndrome. SIDS is the sudden and unexplained death of a baby, usually during sleep with no clear cause. This often happens to healthy babies under a year old. Researchers don't fully understand what causes this, but they believe it might be related to issues with the baby's sleep environment, such as sleeping on their stomach or soft bedding. To reduce the risk of SIDS, parents are advised to place babies on their back to sleep, use a firm mattress, and keep the sleep area free of pillows, blankets, and toys. You can also reduce the risk by breastfeeding your child and using a pacifier during sleep. Pica is an eating disorder where people crave and eat things that aren't food, like dirt, chalk, or paper. It's most common in children and pregnant women, but it can also happen to people with certain mental health conditions. Eating non-food items can lead to serious health problems such as poisoning, infections, or blockages in the intestines. Treatment for pica involves addressing the underlying cause, whether it's a nutritional deficiency or a psychological issue. Therapy and nutritional counseling can help manage the disorder and prevent harmful consequences. Elephantiasis. Elephantiasis is a condition that causes extreme swelling of the limbs or other body parts, making them appear very large and heavy. It's caused by a parasitic infection that spreads through mosquito bites. The parasites block the normal flow of fluid in the body, leading to the severe swelling. There is no cure for elephantiasis, but treatment focuses on managing symptoms and preventing further complications. This includes taking medications to kill the parasites, using compression bandages to reduce swelling, and maintaining good hygiene to prevent infections. Neurofibromatosis. Neurofibromatosis is a genetic disorder that causes tumors to form on nerve tissue. These tumors are usually benign, non-cancerous, but they can sometimes cause pain, disfigurement, or other problems depending on their size and location. People with neurofibromatosis may also have learning disabilities or vision problems. There's no cure for neurofibromatosis, but treatment focuses on managing symptoms. This may include surgery to remove tumors, physical therapy, and medications to control pain or other complications. Prader-Willi syndrome. Prader-Willi syndrome is a rare genetic condition that causes constant hunger, leading to overeating and obesity. It also affects physical and mental development. Children with Prader-Willi may have learning difficulties, short stature, and weak muscles. As they grow older, their uncontrollable hunger can lead to life-threatening obesity. There is no cure for Prader-Willi syndrome, but treatment focuses on managing the symptoms. A strict diet, physical activity, and medications can help control weight. Early intervention with therapies can also improve development and quality of life. Scleroderma. Scleroderma is a chronic autoimmune disease where the body's immune system mistakenly attacks its own tissues, causing hardening and tightening of the skin and connective tissues. It can also affect internal organs, leading to complications with the heart, lungs, and kidneys. Common symptoms include thickened skin, stiff joints, and Raynaud's phenomenon, where fingers and toes feel numb in cold temperatures. There's no cure for scleroderma, but treatments focus on managing symptoms and preventing complications. Muscular dystrophy. Muscular dystrophy is a group of inherited diseases that cause muscles to weaken and waste away over time. Children with this condition may start showing symptoms like trouble walking, running, or lifting objects. As the disease progresses, the muscle weakness gets worse, often leading to the need for a wheelchair and difficulty breathing. While there's no cure for muscular dystrophy, treatments like physical therapy, medications, and in some cases surgery can help manage the symptoms and slow the disease's progression. Research is ongoing to find better treatments and possibly a cure in the future. Conjoined twins. Conjoined twins are identical twins that are physically connected to each other at birth. The degree of connection can vary. They may share organs or be joined only at the skin. This rare condition occurs when the embryo only partially splits during development. The outcomes for conjoined twins depend on how they are connected and which organs they share. Some conjoined twins can be separated through surgery, while others may live their lives connected if separation would be too dangerous. Medical care is essential to ensure that both twins can thrive as much as possible, and in cases where separation is possible, surgery can give them a chance at living independent lives. Flesh-eating disease. Flesh-eating disease is a rare but severe bacterial infection that spreads quickly in the body's soft tissues, destroying skin, fat, and muscle. It often starts with a small cut or injury, but the bacteria can rapidly invade deeper tissues, causing intense pain, swelling, and blackened skin. If left untreated, it can be life-threatening. Treatment involves antibiotics and, in most cases, surgery to remove the infected tissue. Quick medical attention is crucial for survival, and in extreme cases, amputation may be necessary to stop the infection from spreading further. Aquagenic urticaria. Aquagenic urticaria is a very rare condition where a person develops hives or rashes when their skin comes into contact with water. Even though water is essential for life, people with this condition experience itching, burning, and redness after exposure to any kind of water, whether it's from bathing, swimming, or even sweating. There's no cure for this condition, but treatment focuses on managing symptoms with antihistamines or other medications to reduce the skin's reaction to water. Avoiding long exposure to water and using barrier creams can also help minimize discomfort. Hyperdontia. This is a condition where someone just has too many teeth. Instead of the usual 32 teeth, people with hyperdontia have extra ones, often referred to as supernumerary teeth. These extra teeth can cause crowding and discomfort, and sometimes they interfere with normal tooth development. Treatment usually involves removing the extra teeth through surgery, especially if they are causing problems like pain or difficulty in eating. With proper dental care, people with hyperdontia can maintain healthy teeth and avoid complications. Teratoma. Teratomas are a type of tumor that can contain several different types of tissues, such as hair, muscle, or bone. They are often found in the ovaries, testes, or other parts of the body and can be either benign, non-cancerous, or malignant, cancerous. Teratomas are rare, but they can cause symptoms like pain or swelling in the area where the tumor grows. Treatment for teratomas usually involves surgery to remove the tumor. If it is cancerous, additional treatments like chemotherapy may be necessary. Most people recover well after treatment, especially if the tumor is caught early. Brain-eating amoeba, Naegleria fowleri. The brain-eating amoeba is a microscopic organism that lives in warm freshwater like lakes and rivers. If the amoeba gets into the body through the nose, it can travel to the brain, causing a rare but deadly infection called primary amoebic meningoencephalitis, PAM. Early symptoms include headaches, fever, and nausea, but the infection quickly progresses, leading to severe brain damage and often death. There is no guaranteed treatment for this infection, and survival rates are low. However, early diagnosis and aggressive medical intervention can sometimes save lives. Avoiding swimming in warm, stagnant freshwater can help reduce the risk of exposure. Cyclopia. Cyclopia is an extremely rare birth defect where a baby is born with one eye or two eyes fused together in the center of the forehead. This condition occurs very early in pregnancy when the brain and face don't develop normally. Babies with cyclopia usually have other severe birth defects and typically do not survive long after birth. There's no treatment for cyclopia, as it is often a sign of deep developmental problems. Research into the causes of such birth defects helps scientists understand human development, but currently, no interventions can prevent this condition. Botulism. Botulism is a rare but serious illness caused by a toxin produced by bacteria. It can occur from eating contaminated food, having a wound infected by the bacteria, or, in babies, from consuming honey. The toxin attacks the body's nerves, causing muscle weakness, trouble breathing, and even paralysis. Immediate medical treatment with antitoxins and respiratory support is essential. With quick intervention, most people recover, though it may take weeks or months for full strength to return. Fish odor syndrome. Fish odor syndrome is a rare genetic disorder where the body is unable to break down a compound called trimethylamine, which smells like rotting fish. As a result, people with this condition emit a strong fishy odor in their sweat, urine, and breath, even though they are otherwise healthy. There's no cure for this condition, but avoiding certain food like fish can help with decreasing the odor. Some people also use special soaps or medications in order to manage the symptoms and reduce the smell. Harlequinachiosis. Harlequin is a severe genetic skin disorder that affects newborns. Babies born with this condition are born with very thick, hard skin that cracks and forms large diamond-shaped plates. This can lead to problems with movement, breathing, and infection because the skin barrier is compromised. There's no cure, but treatment focuses on keeping the skin moist and soft, preventing infections, and providing care for breathing difficulties. With modern medical treatments, babies born with this condition do have a better chance of surviving and living a more comfortable life. Kuru. Kuru is a rare and fatal disease that affects the brain. It was once found among people in Papua New Guinea who practiced a form of cannibalism, where they ate the brains of deceased relatives as part of a funeral ritual. Kuru is caused by abnormal proteins called prions that damage the brain, leading to symptoms like tremors, difficulty walking, and emotional changes. As the disease progresses, it causes severe mental decline and death. Since the practice of eating human brains stopped, Kuru has become extremely rare. There is no cure for Kuru, and it is always fatal. Treeman syndrome. Treeman syndrome is a rare genetic disorder that makes people highly susceptible to infections by a specific type of human papillomavirus, HPV. This virus causes wart-like growths on the skin, which can become large and resemble tree bark, especially on the hands and feet. These growths can cause pain, discomfort, and sometimes lead to cancer. There's no permanent cure for Treeman syndrome, but the warts can be surgically removed. However, they often grow back. Regular medical care is necessary to manage the symptoms and monitor for any signs of cancer. Progeria. Progeria is a rare genetic disorder that causes children to age rapidly. Kids with progeria usually look normal at birth, but within the first few years, they start showing signs of rapid aging, like hair loss, wrinkles, and stiff joints. The disease also affects their heart and bones, leading to severe complications as they grow older. There is no cure for progeria, and most children with the condition only live into their early teens. However, treatments are being developed to slow down the aging process, and ongoing research aims to improve the quality of life and extend the lifespan of affected children. Stoneman syndrome. Stoneman syndrome is a rare condition where the body's soft tissues, like muscles and ligaments, gradually turn into bone. This process happens slowly over time, leading to a loss of movement as the joints become frozen. People with this condition often experience painful flare-ups, and even small injuries can cause more bone to form. There is no cure for Stoneman syndrome, and surgery to remove extra bone doesn't help because it usually grows back. Treatment focuses on managing symptoms and avoiding activities that might cause injuries to prevent further bone formation. Anencephaly. Anencephaly is a serious birth defect where a baby is born without parts of the brain and skull. This happens when the neural tube, which eventually forms the brain and spinal cord, doesn't close properly during early pregnancy. Babies with anencephaly are often stillborn or die shortly after birth because their brain is not fully developed. There's no cure or treatment for anencephaly. Researchers are working to understand how this condition happens and how to prevent it. Taking folic acid supplements during pregnancy can lower the risk of neural tube defects, like anencephaly. Creutzfeldt-Jakob disease. Creutzfeldt-Jakob disease is a rare and fatal brain disorder caused by prions, which are abnormal proteins that damage brain tissue. People with CJD experience rapidly worsening memory loss, confusion, and difficulty moving, and as the disease progresses, it leads to severe mental decline and death. This is usually within a year of symptoms appearing, give or take. There is no cure for this, and it is always fatal, and it can just randomly develop. Mad cow disease, BSE. Mad cow disease is a disease that affects the brain of cows. This is just like CJD, but humans can get infected by it as well, but it's almost the same thing. Also, VCJD is the same exact thing. Not sure why these are two different entries on the list. Fatal familial insomnia. Fatal familial insomnia is a rare genetic disorder that affects the brain, causing a person to lose the ability to sleep. Over time, the lack of sleep leads to severe physical and mental deterioration, including hallucinations, confusion, and memory loss. The disease progresses quickly, and within months or years, it becomes fatal. There's no cure for fatal familial insomnia, and treatment options are limited. Research into prion diseases like this one is ongoing, but it remains one of the most mysterious and devastating brain disorders. And with that, we have covered the entire disease Iceberg. Leave some suggestions down below as to what icebergs you want me to cover. And yeah, thank you so much for watching. I'll catch you guys on the next one. Peace out.